All right, guys, we're gonna go over the anatomy on the actual CAT scan from today's lecture. So first, I'm on the normal CT of the abdomen. So I want to start with the stomach. So just like last week, go all the way up to the top of your scan. And again, remember the links to these two CAT scans, the normal CT of the abdomen and this next one, which is going to be, I'm going to reference this one for the CTA of the abdomen. Both of those links are in the course under normal CT of the abdomen and then CTA of the abdomen. So again, refer to these to study from. So, okay, starting with this guy, this is the normal CT of the abdomen. Let's start all the way at the top. We're going to look for the stomach now, which we went over last week, but we kind of went in more detail this week. So first you want to look for the fundus, which is the most superior portion of the stomach. It's going to be to the left of the midline. So here's the most superior portion. And then as you go down, you're going to have the medial is going to be from top to bottom, the lesser curvature, and then the lateral side of the curve from superior to inferior is going to be the greater curvature. Goes all the way down to the pylorus, which is the most inferior portion of the stomach, the last portion. And then remember, if I drew an imaginary line from the gastroesophageal junction across to the greater curvature, that would be the line that forms the invisible plane that separates the fundus from the body of the stomach. And remember, the body goes from the lesser curvature to the greater curvature, from fundus all the way down to pylorus. It's the greatest portion or the largest portion of the stomach. So you have fundus, the most superior portion, travel down. Your junction is right about here, where the esophagus is emptying into the stomach, the gastroesophageal junction, imaginary plane here. So now from here down, down, until I get to the pylorus, which is about right here. Everything above that is the body, and from about here is now up is the fundus. Okay, so fundus, body, pylorus. So you should be able to see, I mean, if I'm in the middle of this, you should be able to tell me that that's the body of the stomach. If it's way at the top, you should be able to tell me that's the pylorus, or I'm sorry, the fundus. And then if you're all the way down at the bottom, you should be able to tell me pylorus. And then I also want you to know where the pylorus empties into the first section of the duodenum, which is right here, the duodenal bulb. Okay, so you should be able to tell the distinction between stomach and small bowel. Okay, so that's stomach. I want you to look inside the stomach here. These like squiggly lines in here, that's your rugae. Remember, that's the folds of the interior lining of the stomach, the rugae. This is contrast within the stomach. And then this like mealy stuff, that's probably food that's kind of floating in the contrast in the stomach. All right, because you can see how it's more dense in the posterior aspect because the patient is lying on their back. So the dense contrast is going to be down here, and then air and lighter food particles that are floating in the contrast are going to move to the top or anterior portion of the stomach. So that's your stomach. I want you to be able to distinguish between pylorus and the first part of the small bowel, the duodenum. I'm not going to make you know jejunum versus down here ileum, although it should kind of make sense to you. That's going to be a little bit too difficult, especially in an axial plane. That's a little bit more advanced. I do want you to be able to see the difference between small bowel and large bowel. So small bowel is this stuff here, and then your large bowel has the haustral folds, okay? So you should be able to tell the difference between the two of them. This is haustral folds of the transverse colon here, as opposed to the smaller loops of the small bowel here. Easier way to see the intestines is when we switch to a coronal view. And then this should look very familiar to you guys. This is an AP of the abdomen. The only difference is with CAT scan, we have different slices, whether we're posterior or anterior. So if we start all the way anterior and we scroll back, we're going to see our stomach. So let's try to get the best view of the stomach here. I guess it's probably right about here. So this is your fundus, your imaginary line, here's the body of your stomach. So this is lesser curvature, and this is your greater curvature, okay? And then your first part of your small bowel is going to be right. This is still pylorus right here, small bowel right here, first part of the duodenum right here, okay? So there's your stomach. Now when we go to the intestines, it should be much easier to see intestines, okay? So if we start at the front and go back, let's just go anatomically. We have ascending colon here. It's a little tortuous. Ascending colon, and then you want to follow it. Here's your transverse colon. And I'm scrolling front to back because the bowel loops in and out, front to back, side to side on itself. So you want to follow it. Follow where it goes. This is your transverse colon. Here it kind of looped, it kind of went down. It was like redundant. Did you see that? So it goes up and then it kind of goes redundant down. Here's transverse. Up to our splenic flexure over here. And then now I'm going back down. Here's our descending colon, see? And now it's kind of going anterior again when we hit the sigmoid. Here's sigmoid here, a little anterior. And then it goes a little posterior. Sigmoid comes across. And here's your rectum right there, okay? And then all these smaller loops in between is your small bowel, okay? Your ileum is down in the right lower quadrant. Jejunum is mostly left upper quadrant. And then the duodenum is the smallest. It's just posterior or just distal to the stomach, kind of in this area, and it sweeps across and joins up with the jejunum. Okay, so that's really all I'm going to have you know as far as the intestines go, because that can be kind of hard to see, as you can tell. I'll probably ask you in a coronal view, or if I ask you in an axial, I'm going to be pretty specific with the image that I show you, so that I'll probably ask something simple like, is this large intestine or small intestine, or is this large intestine or small intestine? And you definitely should be able to tell the difference. Okay, so that is the stomach and intestines. Now we need to move on to the arterial and venous flow in the abdomen and pelvis. So I'm going to switch over to our, this is a Bosniak renal cyst, and I just liked it because it has all of these different phases. And it also has a really good sagittal reconstruction and coronal reconstruction. So I wanted to show that. So I'm going to click on the cortical phase, because cortical phase, as we know in CT terms, as far as the timing, is going to be an arterial phase. See how the aorta is nice milky white? It's a bright milky white. That means we are in the arterial phase of the aorta. So the contrast is mostly flowing in the arteries of the circulatory system. So here's our aorta. We're going to follow the aorta down, 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 down. And the first branch that's going to come off anteriorly is your celiac axis or your celiac trunk. Remember, the ones that I have highlighted on the PowerPoint, those are the arteries that you should be able to see. They're the easiest, and as a CAT scan tech, they're the ones that you're going to have to be referring to. The phrenic artery is up here. It's very difficult to see on this guy, and I don't even see it. No, I can't even see the inferior phrenic artery. So here's your celiac axis, your celiac trunk. I want you to see how short that trunk is from the aorta to where the first branch is, okay? So it's a really short trunk, okay? That's your celiac trunk. Remember, your celiac has 3 branches coming off of it. The 3 branches, you have your left gastric. So your first one that's going to come off to the left, which is over here, here's the stomach, is going to be the left gastric. Sometimes the left gastric comes off the splenic. On this guy, I think that's going to be the case. And then the other one that goes to the right is your common hepatic artery. Okay, so you have your common hepatic to the right heading over to the liver. That's going to give you your rich oxygenated blood to your liver. The next branch is going to be your splenic, which I believe is going to branch again to the gastric. And you can follow this over. So here we go. Follow it down, 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 down. That's actually up. And it's going to follow right along. It's not a really good phase. Right along, it takes a sharp turn here to the spleen. Okay, that's your splenic. And your left gastric is off of here. It's really small. It's very hard to see on this. So the three branches, the three branches that come off the celiac trunk, the common hepatic, our splenic, and then our splenic is going to take a separate branch, or it has its own branch to go over to the left gastric, feeding the wall of the stomach. And remember that the splenic that comes over and feeds the spleen also has multiple branches that are going to feed the tail of the pancreas and the body of the pancreas. Okay, so that's your celiac. The next artery, when we travel from superior to inferior, is going to be, let's go up, your superior mesenteric artery. So there's your celiac. Let's continue down. Here's your SMA, your superior mesenteric artery. And all of your anterior arteries that come off of the aorta travel directly anterior, and then most of them, almost all of them, take like a sharp turn down. And then they might go left to right. So with our, go back up to the celiac artery comes over, it goes down a little bit, and then now it's going to split right and left. Going down to the SMA, it comes off anterior, and now it shoots straight down. That's why we're seeing it like this circle. It's going to go straight down, okay? And then that's going to head down. It's going to branch off and feed the head of the pancreas over here. And then start supplying the large bowel. Branches are going to head off. There's a branch heading over to large bowel over here, on the left side of the patient. And then it's also going to do all of the small bowel. So all of the small bowel in here is going to be fed by the SMA. And the appendix, ascending colon, and the first third of your transverse colon is all going to be fed by the SMA. And if you follow it, it's going to start branching these little branches heading over it. And that's as low as it gets. So your SMA comes out and then takes a dive straight down. The next vessel that you're going to see on this guy is hard to see because his looks like it's calcified. So if we look at the aorta and we now travel down, see this little intense bright white? That's calcification in the artery. So he looks like he has calcification of his IMA, which is very common. There's a lot of collaterals that can build in and feed blood supplies to these areas of the body, and it's not uncommon to see some calcification in the IMA. It's hard to see anyway. It's one that you should be able to at least know where it is. Here you should know that that calcification is where it should be branching off, and it's still there. It doesn't look like it's completely occluded, but it's going to slow down the blood supply. So that's your IMA. The easiest way to see those vessels, the vessels that come off anterior from the aorta, these guys, is to look at it in a sagittal plane. So let's go to our sagittal image. This is sagittal. Okay, so we can go side to side. We're going from right to left or left to right. You want to get somewhere to the left of midline because that's going to be where your aorta is. And then you want to see the fingers that come off the front portion of the aorta. Your first one is your celiac. Your second one is your SMA. And then your third one, which we can't quite see because it's calcified, is the IMA right here. And he's calcified. There's a little piece of plaque right at the entrance of the IMA at the aorta. Okay, so that's the easiest way to see the 3 main unbranched vessels coming off the anterior portion of the aorta. All right, so let's go back and look at the axial just so we can see the renals. We haven't looked at the renal arteries yet. Here's aorta. The renals are below the celiac and below the SMA. Okay, so when we start up and go down, there's your celiac coming off, there's your SMA coming off, and now we're going to look for a pair of branches coming off the side of the aorta. The one on the left side is your left renal artery going into the left kidney, and the one on the right is your right renal artery going into your right kidney. Okay. The right is slightly longer than the left because the aorta is slightly to the left of midline. Okay, so follow it over, and this is where you have to follow up and down because I can see where the left is coming off, which is a little bit higher than the right, which should make sense. I can see a good sweep of it, a good stretch of it here, but I'm losing where the end of it is here, so I have to go down a little bit. It actually goes down a little before it enters into the hilum of the kidney. All right, and let's go back. Here's our right coming off of the right side of the aorta, and you can see it kind of dips down and then back up. That's why I'm seeing a circle here and a circle here. That's both the right renal artery. As it comes off of the aorta, it's going to dip down, come across, and come back up before entering into the kidney. Okay, and then remember, once it enters into the kidney, it's going to start branching into different segments, the apical, the upper, the middle, the lower, and the posterior, and then further dividing each of those into interlobar, arcuate, interlobular, and then down into the cortex and the nephrons. Okay, so further dividing all the way down to feed all the way out into the cortex of the kidney. So those are your renal arteries, right and left. All right, those are the main ones that I'm going to have you be able to see on a CAT scan. So now we can move over to the inferior vena cava, which is a little bit harder. Vascular system is a little bit tougher to see. Let's see if we can switch over to our parenchymal phase, which is more of a delayed phase. So you can see how I still have kind of grayed out in the aorta, but the inferior vena cava is essentially the same opacification. So we're a little bit delayed. So that means that the contrast has circulated all the way through the arterial and the venous system, and it's now traveling back through the venous system. So the aorta and the inferior vena cava essentially look the same. So we can still see our vessels coming off of the aorta. You can follow the aorta down because this is the same patient. So there's your celiac, there's your SMA, the IMA, we're going to see that calcification where it should be. Follow it down, and then here is where the aorta bifurcates. Okay, goes down and spreads into the left and right common iliacs. Right, so going down to the inferior vena cava at about the level of L5 is where the inferior vena cava comes together, which is about here, and forms the inferior vena cava. There you go. Your inferior vena cava coming up, that's where your left and right common iliacs come together to form the inferior vena cava, and now we're traveling up vena cava. There's your renal arteries, your right renal artery and your left renal artery. And remember that the right now is going to be shorter and the left is going to be longer, and that's because the inferior vena cava is more to the right of the patient's midline than the aorta is. So the right renal vein is going to be shorter than the left. You have, coming back up here even more, now we have our inferior vena cava is entering into the liver, and it's traveling up through the caval hiatus into the thoracic cavity. Okay, so there's your inferior vena cava right there. We can now move over to our hepatic portal system. And I had a different video. I'll post a different video of I have a better one that shows a really good oblique plane of the liver. But what we can definitely see here is, I want to show you, this is your superior mesenteric vein coming up, combining with the splenic, which is coming here. Here's your splenic vein coming across, combining with the inferior mesenteric to form the portal vein. There's your portal vein, the bottom hand, remember? Bottom hand coming in. Here's your left portal vein. There's your right portal vein. Okay? Portal is much easier to see than hepatic. In an axial view, the hepatic system is much easier to see in this weird oblique coronal plane, because remember, that's the top hand, and it branches off from the aorta, but it's really muddied in here once the inferior vena cava, as that enters into the liver, it starts to get really muddied in here, especially if you don't have the right phase. So looking at it in the correct view is going to help you to see the hepatic part of the hepatic portal system, the top hand, if you will. And that's, again, we can also try to see that. Let's look in the coronal view. So let's center this. Let's start all the way in the front. And see, this is kind of sliced off. Here's your portal system right here. There's your portal vein, your splenic vein that's come across here. Superior mesenteric vein, and then your portal vein. Your right portal, and then there's your left portal vein. Okay. Here's your inferior vena cava coming down. This is probably the first branch right here, coming off the inferior vena cava as it travels into the liver, the hepatic vein, and it's cut off. It's hard to see anteriorly. There it is as it's coming in to the liver, and then the rest of the inferior vena cava travels down through the rest of the body. Okay, so that's your circulatory system. Remember, the lymph nodes you're not going to be able to see because this patient doesn't have lymphadenopathy. If they had lymphadenopathy or swollen lymph nodes, we would be able to see them. Otherwise, it's very difficult, near impossible, to see any lymph nodes because they're little circles that travel around major vessels. Remember, it's these tracks of conduits with little nodes in between. This is probably a little node right there. But if it doesn't measure more than, I think it's 1 centimeter or something, they don't even consider it enlarged. So you'll see some of these little dots are not necessarily vessels that are being sliced at the right axial slice. Some of these are lymph nodes in here. They travel along the aorta and along the inferior vena cava. So very difficult to see. We're not going to be able to see them on this. If you do go to Radiopedia, if you go up here and type in lymphadenopathy, you'll definitely get a hit, and you'll be able to scroll through a scan, and you'll see a patient with lymph nodes, swollen lymph nodes in the abdomen, and you can't mistake them. They're right there. There's no way you can't see them. So the last things that we have to look at are the abdominal wall muscles. The most important ones that I want you to be able to see are the rectus abdominis muscles right here. They are just the series of muscles that lie just lateral to the midline. This is your midline right here. And then this band of fibers here is your linea alba. Sits just below the skin. This is like subcutaneous fat, and this is the skin up here. This is muscle, this darker gray. That's your rectus abdominis muscles. And then remember I told you the 3 muscles that are sandwiched together on the lateral abdominal walls. Those are your external and internal obliques, external, internal obliques. And then all the way in here on the inside, the transversus abdominis, which is the medial layer of the muscle just on the exterior of the abdominal wall. Okay, so that's the sandwiched 3 muscles, the external oblique, internal oblique, and the transversus abdominis. Psoas muscles, you should hands down always be able to see the psoas muscles. They lie just lateral to the body of the lumbar spine. These guys here that lay just off to the side of the psoas muscles, those form a large portion of the posterior abdominal wall. That's your quadratus lumborum. And then these big juicy guys that lie just lateral to the spinous process are your erector spinae muscles, okay? Those help you to stand upright. You should be able to see all of these muscles. You should be able to identify them on an image on a test. The ones that I just mentioned, the quadratus lumborum, just posterior to the psoas muscles, you should be able to see psoas muscles, the erector spinae muscles, your sandwiched 3 muscles in here making up the lateral abdominal wall, external and internal, internal obliques, your transversus abdominis, and your rectus abdominis, connected by this band of fibers, which is the linea alba.